Taketa-Wong, a physician who believes that educating patients and the community. Today, I'm very excited for you to meet Russell. We have him here with us on Zoom. He is a Parkinson's patient whose disease progression has actually stopped and has actually seen improvement in his condition. So what I'd like you to take away from the event today is that the combination of cutting-edge technology as well as natural medicine protocols and a motivated patient can accomplish astonishing medical results. So Russell, we'll get to hear from you momentarily, but I just need to do a brief introduction. Is that okay? So just by way of introduction, we talk about with naturopathic medicine that we really see the body as a whole. And because every aspect of our body is connected, having the nutrients that we need really is the foundation for a healthy life. However, in the United States, fewer than 20% of conventional medical schools require any courses in nutrition. Of those 20%, the typical offerings total fewer than 25 hours of training in nutrition. So that's 25 hours of training in nutrition in 4 years, when these days, most of our chronic diseases can be food related. Naturopathic doctors like myself typically receive 155 hours of nutrition education and training. So we're trained to educate and guide patients to build health from the inside. So while I attended a 4-year medical school, just like MDs, and order lab tests, write prescriptions and such, I approach treatment comprehensively, including all aspects of a person's health, which is why my patient visits are 1 hour, not 10 or 15 minutes. And it really is a partnership for health between me and my patients. If you have a health condition that you would like to talk with me about, please contact the office and schedule a free phone consultation. There's no charge because I don't take new patients without reviewing their situation first and coming up with a plan to help you get better. We really want to make sure that we feel confident we can be able to help you get better. All the contact information is on our Facebook page, and you can click on the link in the post with this video. So again, thank you so much, Russell, for joining us, and really excited to be able to talk with you. It really is a privilege to, to be able to talk with you about your experience and what you've seen. So let's just start with a brief overview. So please stop me if I get something wrong. But from what I remember, so you first noticed symptoms in November of 2020, and you were diagnosed with Parkinson's 2 months later in January 2021. And then at that time you got a prescription for a Parkinson's medication. Then later that month we had a phone consultation to see if there was anything I could do to help. And when I first saw you in February 2021 was about a month after you were diagnosed. And your symptom at that time, the only symptom, was a constant tremor in your right arm. And your goal was to prevent or at least slow the progression of the disease. Is that about right?
Yes.
Yeah. And can you tell us a little bit more about what you thought and felt when you first got your diagnosis of Parkinson's?
Okay, I went to see my primary care physician in November of 2020, and I told her I noticed this tremor in my right arm. What could it be? I suspected Parkinson's. I wasn't really too sure about it. I didn't study it much, but I know Parkinson's patients suffer from tremors. So he said he suspected Parkinson's, but he wanted to send me to a neurologist to confirm it. But I had to wait 2 months to get an appointment. When I finally got to see my neurologist, he ran some tests on me. It's basically physical. Touch your nose, touch the tip of his finger, put your hands on your lap and flip it back and forth over and over. testing your strength, testing your balance. And then he said, oh, yeah, you're Parkinson's. So I asked him if there's any medication that would help to slow down the progression. And he told me there's a drug, Azalect, that supposedly slows the progression, but he said it's kind of controversial because a lot of neurologists don't believe that it helps at all. But I started taking it anyway. There are drugs that'll stop the tremors, but when I read about it, there's just too many side effects to it. And I didn't want to experience those side effects because a lot of it, the levodopa, carbidopa, they give you that, but your body gets used to it. So you eventually start taking more and more of it. You take a higher dosage, and then some patients actually have to take it once in an hour, which I said, no, I don't want that. I mean, I'm fine with the tremors, it really doesn't bother me. I'm still able to do what I like to do. I like to do woodworking and stuff. And I can continue to do that because it's what they call resting tremors. So if I use my arm, it'll stop. It's just when it's resting phase, then it'll start to shake. So that's the only symptoms I have right now. It hasn't progressed, thanks to Dr. Taketa-Wong, who introduced me to NeurOptimal. And she could better tell you what it's about. But I tried it, so I go for treatment once a week. And it's about a little over half an hour. You watch this video with this, they put these attachments to your head, and you just watch this video, and it's supposed to retrain your brain or something. But I noticed that my tremors are lessened now. It's not as often, so I could go longer periods without it shaking at all. And I haven't developed any new symptoms. When I saw my neurologist last, he asked me, have you noticed any slowness in your movement? I said, no. So he was a little surprised. He said, by now, there's Parkinson's patients tend to slow down. Their movements start moving slow. They have a hard time getting dressed in the morning. But I don't have any problems. There's just so many. When I read up on Parkinson's, there's just so many different types. No one will get all of them, but everybody will progress over time.
Mm-hmm.
So I'm just trying to control it, and this NeurOptimal seems to help. I haven't developed any new symptoms in about a year and a half now, maybe a little more than a year and a half. So
Yeah.
I'm happy with it. I'm actually delighted.
Yeah. Yeah. So let me just tell our viewers, just to give familiarize people, because there are many people who may not be familiar with Parkinson's or what happens in the the course of Parkinson's. So just for our viewers, so Parkinson's it's a nervous system disorder that's known to be progressive, and that means that it gets worse over time. So medication can often slow the progression, but in the experience of many Parkinson's patients that I've treated, many people have come to me and they're on medications, but we haven't found that the medications will stop the progression. And so progression typically takes the forms of additional symptoms. So usually the next changes in mood. Often handwriting tends to worsen, as does sleep. People's muscles start becoming rigid and stiff and painful, and their movements can look jerky or kind of hesitant. And further deterioration can also make their speech become slurred, or that people will start speaking where it's their volume gets softer, and so they have to use a lot. And then, in a nutshell, that pretty much describes the condition. Um, you know, I'm curious, what did your neurologist tell you about the disease and what you could probably expect with taking Azilect, that medication?
Well, he told me he believes in Azilect. He thinks that it'll help to slow the progression of it. It won't stop it, but it'll at least slow it down to where I'm comfortable. And like he said, there's other neurologists that don't believe it, doesn't think it helps at all. So, it depends on the individual. It's like any other medication. It may not help everyone. It'll help more than a few, but I'm hoping that I'm one of the few that it does help.
Yeah.
So, why not try it? There is no cure for Parkinson's, so you might as well give it a try, by a
Yeah.
naturopathic physician.
Yeah.
I think it will help.
Yeah. And typically, I mean, usually at the within a year, usually we will start to see, even on medications like Azilect, we typically will start to see additional symptoms. So that's at least been my experience. It may slow the progression, but I've seen that it hasn't, on the Azilect by itself, I haven't seen that patients stop, developing additional symptoms. So, usually after a year, the expectation is typically that there would start to be slowing of movements, more difficulty with walking or balance or things like that. And then, do you remember, at our first appointment, do you remember what I shared with you about Parkinson's and how I would approach treatment?
I don't remember.
Yeah, no, that's fine. I know that was a while ago. But yeah, basically, I mean, the approach that I take in terms of treating Parkinson's, there's a lot of research finding that certain types of exercises are really important. So exercises using big movements, exercises that are using different kinds of movements that you're not used to. So going to a new exercise class where you're not familiar with the movements, and maybe you might feel awkward at first, but that's actually really good for Parkinson's. And then also very big movements, exercises that use really big movements are really helpful. So we talked about exercise and how important that was. Also with diet. So there's a lot of research finding that there are certain dietary things that may be helpful in the context of Parkinson's, and certain foods that create more inflammation tend to be more problematic. So one of those, for example, is dairy products. So they found that an association that dairy products are associated with a faster progression of Parkinson's, and they found that overall patients who are consuming a diet that is primarily lots of fish, nuts, beans, very low or little to no red meat, no dairy or very little dairy, and then eating lots and lots of fresh fruits, vegetables, berries, like I mentioned, a lot of the good fats like nuts, seeds, fish, and that really is like the bulk of their diet is vegetables and those kinds of good fats and good protein. And so we talked about, diet and recommendations for that. There's also certain supplements that I found helpful with decreasing the inflammation. And there's the NeurOptimal as well. So, I had asked you to make changes in the way you're eating, and you made all of those changes. I really want to acknowledge you, because I know it's not easy to, to change your diet and change what you're eating. But you did all of those things, and so I really want to acknowledge you. And I remember that as you changed what you were eating, that you also lost some weight, and then things like your blood pressure, has gotten better. Um, and so, one of the things is that you're on 2 blood pressure medications when you first came, and a gout medication, and we were able to successfully wean you off of your gout medication, as well as wean you off of one of your blood pressure medication. Yeah. Advice for ways to eat, in terms of changing your diet, or because
I
it's
know,
not
because
easy to do.
I know. I love my yogurt. I used to have it every morning up until he told me about dairy products is not good for Parkinson's patients. So I started to buy the non-dairy yogurt. There's the almond milk yogurt and the coconut milk yogurt. So I buy those. I just buy the plain ones, and I may add blueberries to it. It's good. And avoiding the big game fish like tuna, marlin, too much mercury in it, so try to avoid those. So I still love my fish, so I'm sticking to salmon right now. So I'm trying to cut back on all the foods that he said cause inflammation. To follow it. So I actually lost 20 pounds. So I'm down to 150 now. I used to be 170. So that's helping my blood pressure and my blood glucose. My A1C dropped. So I'm happy with that too. So the diet makes a huge I'm more alive now. I seem to be more picky. I go to work.
Yeah.
I want to do something. An 8-hour day doesn't seem to be enough. I'll come home and do yard work. A lot of yard work. You saw my yard. I got mangoes every day.
Yeah, that's great, and that, like, food can be our medicine, like I've seen a lot of patients where, what we eat really makes a big difference in terms of how we feel, so, yeah, so that's great. And next I'll be explaining a little bit more about NeurOptimal, neurofeedback, how it works, and Russell touched on that. And we'll get a little bit more into that, but I just want to pause a moment to remind those of you who are just joining us that if you do want to talk with me, we have a no-charge phone consultation where you can talk with me personally about any health concerns that you have, and about how to feel empowered with your health. So arranging a consultation is very easy. All the contact information is on our Facebook page. And as a quick side note, if you're looking to purchase supplements, including ones that help to reduce damaging inflammation and provide your body with the nutrients for optimal health, it's really important that they are third-party laboratory tested for quality. So I invite you to check out our online supplement store. It's the only one where all the proceeds go to supporting treatment for children with special needs. You'll also receive 20% off of the regular prices, which typically meets or beats Amazon or other online retailers. And our online supplement store is at Dr. Taketa-Wong. That's Dr. Taketa-Wong. And you'll find the link in the post with this video. So NeurOptimal is a form of neurofeedback. So Russell, I'll just explain to our audience a little bit about what NeurOptimal is and how it works, and you touched on it already. So NeurOptimal, as I mentioned, is a form of something called neurofeedback. So what is neurofeedback? It's a non-invasive treatment where a machine provides feedback. You can think of it as information to the brain about your brainwave patterns. What's happening with NeurOptimal is that there are sensors attached to the ears and scalp with a lightweight adhesive. The machine picks up on your brainwave patterns, and it translates that into sound frequencies which are embedded in music. So when a person hears those sound frequencies, it's telling the brain, these are the brainwave patterns that are going on. It's like looking at one's brain in the mirror and letting it see its own brainwave patterns. An example that I give is that if you are wearing a hat and it's crooked, you may not know from the way that the hat feels on your head that it's crooked. But when you look in a mirror, then you can see, oh, my hat's crooked, and then that it needs to be straightened out, and then you can see how to correct it. So NeurOptimal is based on the way that the brain, like all areas of the body, will always try to heal itself. So what this neurofeedback does is that it allows the brain to correct any irregular brainwave patterns. So like other conditions such as anxiety, depression, autism, and ADHD, research has found that in Parkinson's, there are abnormalities in the brainwave patterns. NeurOptimal neurofeedback is basically training the brain to maintain proper brainwave patterns by giving it the experience of being balanced. And it's kind of like training wheels for your brain. That's another analogy that I give. So now, Russell, I just wanted to get a little bit more into the details of your experience with using NeurOptimal. And then when when you started, you mentioned you had a constant tremor in your right arm. And then you mentioned that as you were using the NeurOptimal machine for the very first time, then your tremor actually stopped, right? And then could you tell us a little bit more about that?
It's hard to explain, but I know once the video starts, I'd say it takes anywhere from 15 seconds to about 3 minutes in, and my arm will stop shaking. The entire video that I'm watching, it'll stop. And once it stops, then my arm starts to shake again. But I'm hoping that it'll carry over for longer periods after it stops. So I noticed that sometimes when I go home, it usually starts to shake while I'm driving. But I noticed that lately, it doesn't shake when I'm driving on the way home. So it's a longer period that it's not shaking from when I end the session.
Right. And yeah, and so before, oh, go ahead. Yeah.
So it's like I said, it's just hard to explain why. I have no idea. But the video that they show, I was just telling that to some of our assistants that I used to do these kind of hard work in intermediate school, art classes. So these are the exact kind of stuff I used to do. So it brings back all these memories of, I used to do something like that, something similar to that. But it's interesting. It's all different. I had many sessions and there's not one that's the same. They're all different.
Yeah.
But they all work the same way.
Yeah, so basically with the part that you're talking about with the video is that so there's it creates like kind of what looks like screensaver types of patterns, to the music. And the main like some of the therapeutic effect is in the video, but most of it is in the sound frequencies that you're hearing. And the session is 33 minutes long. And I know you said before you started doing NeurOptimal, the tremor in your right arm was constant unless you were sleeping or unless you moved your arm, right? Like unless you're moving it to like write or do something, then the tremor would stop. But if it was at rest, it was just shaking constantly, right? And then I remember you said that from the very first session, so within, pretty quickly, within a few minutes to a few seconds after it started, your tremor would stop. And I remember you said for the first session, as soon as we turned off once the session ended, then your tremor started again, right?
Right.
Yeah. And then I remember you said that as you continued, and that happened every single time you would do a NeurOptimal session, that when you would do a session, once the session started, within a few seconds to a few minutes, your tremor would stop, and then it would be gone for that whole 33 minutes. And then
Right.
initially, you said in the beginning, once the session ended, the tremor would start again. But then now, as you mentioned, you're noticing, you said for anywhere from 10, sometimes to 20 minutes after, now that the tremor doesn't come back until about 10 to 20 minutes after the session is done now.
Mm-hmm.
Yeah, which is really exciting to see that, that improvement, because typically the course with Parkinson's is that the tremor would continue to just get worse and worse. We wouldn't expect it to get better,
Yeah.
Yeah, so
Because it stayed the same from when I first came, it wouldn't bother me. But being that it shakes less now, I get longer periods without it shaking. To me, is an improvement. It's not
Right.
getting worse.
Right, yeah. And then you mentioned too that now, because before you said that the tremor was always there, right? Unless you were sleeping or intentionally moving your arm. But then you mentioned also that now you have periods where outside, or like away from the NeurOptimal sessions, where you'll have periods, you said about 3 times a week now, where your arm, where you won't have the tremor for anywhere from, I think you said it was about 20 to 60 minutes or so.
Yes.
Yeah.
Mhm.
Could you tell us a little bit
That was really surprising. But I have good days and bad days. Bad days aren't really bad. They're just bad compared to what it could be. But as a whole, I have good days. The good days, it doesn't shake as much. I'm at work, I'm really sitting down, reading something. Excuse me. It'll start to shake. So even if I'm holding a book or something, it'll start to shake. I'm holding my iPad, it'll start to shake. But now I notice that it doesn't shake as often. Before, I can't hold it with my right hand, but it'll shake the iPad, you can't read it anymore. It's just, so I'm happy that it's lessened tremors somewhat, and that wasn't expected at all. I'm just surprised that no one else had suggested trying NeurOptimal. I'd never heard of it before until Dr. Taketa-Wong mentioned it.
Oh, yeah, no, can you close it?
I said, why not?
Thank you. Oh,
Might as well try it.
yeah.
And
Okay.
I'm glad I did.
Thank you. Yeah. Yeah. So, yeah, I know. I was so happy that, just to see, that, that improvement, because it's typically not expected, right, to see improvement. And then, can you tell me about when you saw your neurologist recently? So you saw your neurologist again after, about a year, right? Could you tell us what happened at that appointment?
That was April 18th when I saw him last. And he asked me, have you noticed any slowness of movement? And I told him no. He said, okay, let's go out in the hallway. He did his usual test, touch your nose, touch the tip of his finger, do the flips of your hands, not stomp your feet, but tap your feet, left side, right side, test your strength, test your balance. hours, and he makes me go out into the hallway, go walk back and forth. He looked normal to me. So I expected slowness in movement by now. Because normally, he said, it's too hard to predict. You don't know what a Parkinson's patient's going to develop, what's going to come next. But usually, it's slowness of movement. You're going to get a harder time walking. But I told him I still run. I still run in the morning before I start work.
Yeah.
So he was surprised. You still run? I said, yeah. So he was surprised that I didn't develop any slowness of movement. He said, usually that's the first to come. Almost everybody gets that. And almost every Parkinson's patient gets that. So he said, oh, I'm surprised. He said, good for you. Just keep doing what you're doing. So I always try to keep moving, doing stuff, yard work, wash cars. I got the cleanest car in the whole neighborhood. I do it so often.
Yeah.
Out there goes Russell again washing his car. Every time I look out there, he's washing cars.
Yeah.
Don't worry, I don't need too much water.
Yeah, but it's pretty amazing that there was, no slowing of your movements, at all in a year, and that you're moving and walking as well as you were a year ago. You have no balance problems at all, and that you're still jogging. Do you jog every day, or?
Every day before I start work. So if I'm going to work, I'll do it. But if I'm at home, I use just my machines.
Yeah.
My elliptical, bicycle.
Yeah, so that's great. And then could you tell us a little bit about the exercises that you're doing?
Well, there's at excuse me. I try to do core exercises. Try to strengthen your core. That helps your balance. I do the elliptical. I have this. It's called TheraCycle. It's a bicycle that's made for Parkinson's and multiple sclerosis patients. It's specifically for them because this bicycle is a little different in that the arms moves too, not just the legs. So the arms and the legs move. Because I was reading up about it, what kind of exercises should I be doing? So they recommended this, the TheraCycle. So I got that. Of course, no one here sells it. You have to order it from the mainland. And cost of shipping is kind of high too. But for me, it was worth it. So I do that every day.
Yeah, so yeah, again.
It seems to help,
Yeah, so that's great. So we'll go everyone to take away from my talk today is that Parkinson's disease can respond positively to NeurOptimal neurofeedback in conjunction with a healthy food regimen and specific exercises. And a crappy diet is definitely going to undercut the positive effects of NeurOptimal. So you do really that's so important, as Russell mentioned, that it's just so important to eat well and think of food as your medicine. And as I mentioned, besides the progress that Russell's made with Parkinson's, we were able to get him off of his gout medications and one of his blood pressure medications and lower the dose of his second blood pressure medication. Next, I want to focus on trying to wean you off of your cholesterol medication. Of course, it is important to note that whenever someone is weaning off of a medication, it really needs to be done under the guidance of a medical professional. So I just wanted to close. I just seen Russell. Is there any last words that you wanted to share with our viewers, or anything that you feel would be helpful for other people, living with Parkinson's?
I think you should try other alternative medicines. Because like I said, there's no cure for Parkinson's. Some of the symptoms, but it's not gone. It's still there. But like I said, there's too many side effects that you can get. I've seen people, they did stop the tremors, but now they don't have any balance. They keep falling.
Mm-hmm.
They're always dizzy. They're going to develop something else. And a lot of it, you don't have medications for that something else that you get.
Mm-hmm.
So for me, that wasn't an option. But
Yeah.
I'd rather just, like I said, I'm fine where I am. It doesn't really bother me.
Mm-hmm. Yeah.
Except when people look at you funny.
Yeah.
But, they're strangers.
Yeah. So, yeah. And again, it's just been so, just so exciting to be able to see like how, not only your Parkinson's not progressed, but that, you've actually gotten better, that we've seen improvements with your, with your tremor, which is, really, it's just really unheard of, with Parkinson's. So, again, thank you so much, Russell, for being here. Really, really appreciate your time and sharing your experience. And for our viewers, I trust that our discussion about Parkinson's disease has been useful for you. Does your doctor take the time to educate you like we're doing here today? So if not, you're welcome to talk with me personally about any health concerns that you have. And our goal really is to help you to feel empowered with your health, because that knowledge is just so important. And so to do so, you can just call or text our office to schedule a free phone consultation with me. There's no charge, because I don't take new patients without talking to them first. I always want to make sure that what we do fits their needs. And you'll find all the contact information on our Facebook page. Also, please be sure to check out our online supplement store. It's the only one where all the proceeds go to supporting treatment for children with autism and other special needs. It's also one with tested, trusted products and a 20% discount. You'll find it at drtaketa-wong.com. That's drtaketa-wong.com. And then you'll find the link in the post of this video. So again, Russell, thank you so much for sharing your experience and really just kind of some of these, we like to call them slow motion miracles, So yeah. But again, mahalo everyone for joining us. And we'll see you again in 2 weeks. Aloha.
Aloha.